Welcome back to MedMind.
We've got 40 questions about the anatomy of kidneys. You'll get 1 point for every correct answer. Let's see if you can get a perfect 40. The lateral margin of the kidney is concave, while the medial margin is convex. An adult kidney typically weighs between 100 grams to 120 grams. The kidneys are urine-producing organs, while the bladder and ureters are urine-excreting pathways. The left kidney is situated slightly lower than the right kidney. The kidneys are situated in front of the peritoneum in the lumbar region. The surface of the kidney is dark red and smooth, and it is dense in consistence. The Hilum renale, is an excavation found on the concave medial margin of the kidney. The inferior extremities of the kidneys are situated closer together, 7 to 8 centimeters, than the superior extremities, 11 centimeters. The kidneys regulate water-salt metabolism and acid-alkaline balance of the blood. The superior extremity of the left kidney is situated on the level of the middle part of the 11th thoracic vertebra. The 12th rib crosses the posterior surface of the left kidney closer to its superior extremity. The liver is in contact with the lower one-third of the anterior surface of the right kidney. The posterior surface of the kidneys is adjoined to the posterior abdominal wall and the diaphragm. The fibrous capsule, capsula fibrosa, is easily stripped away from the kidney. The medial margin of the right kidney is in contact with the descending part of the duodenum. The lateral margin of the left kidney is situated near the spleen. The fixing apparatus of the kidney does not include nerves and lymphatic vessels, only the artery, vein, and ureter. The perirenal fat is called the renal fascia, fascia renalis. The renal fascia is presented by two layers, the prerenal, superficial, and postrenal, deep, layers. The inner region of the kidney is called the cortex, and the outer zone is the medulla. The renal medulla penetrates into the organ in the form of renal columns. The base of the renal pyramid is directed to the minor renal calyx. The renal pyramid and the cortex adjoined to it form the renal segment. Each renal papilla on its apex is surrounded by a major renal calyx. Two to three major renal calyces unite to form the renal pelvis. The minor and major calyces and pelvis are situated in the renal sinus and are surrounded by fatty tissue. The structural and functional unit of the kidney is the renal lobe. The total length of all the nephrons of both kidneys reaches 10 kilometers. The renal body, corpusculum renale, consists of the nephron capsule, Bowman's, and the glomerulus. The afferent arteriole that enters the glomerulus is smaller in diameter than the efferent arteriole that leaves it. The juxtaglomerular nephrons form 80% of all nephrons. The epithelial cells of the inner layer of the nephron capsule are large and are called podocytes. The podocytes have large wide appendices called cytopodies that are attached to the basement membrane. The walls of proximal convoluted tubule is covered with simple flat epithelium. Reabsorption of proteins occurs on a level of the proximal convoluted tubule. On a level of the Henle's loop, the reabsorption of water, Na+, and other substances occurs. The absorption of big quantities of water occurs through the walls of the distal convoluted tubule. The mucosa of the urine excreting pathways is covered with transitional epithelium. The endocrine complex of the kidney only participates in regulation of general and renal blood circulation, not urine production. The renal artery, which supplies blood to the kidney, is a branch of the inferior vena cava.
Comment down your answer. Also, I hope you enjoyed this video. Your final scores. If you do, please don't forget to like, comment and share this video. Quizzes, subscribe the channel. Also, don't forget to subscribe the channel and press the bell icon. Thanks for watching, so that you don't miss out the next video. For now, you can continue with the next video or can go through the complete playlist provided here.